I'm Shelly Collins. I'm a student nurse at MUW. Today we're going to do a head-to-toe assessment. Is that okay with you?
Yes.
Okay, at any point in time, if you feel uncomfortable, you have the right to refuse. You also have the right to confidentiality. So, is it okay if I share this with a classroom?
Yes.
Okay, and then also you have the right to privacy, so that is why we're in an enclosed room. Okay, now we're going to move on to the head-to-toe assessment. We're going to first inspect the skin, and we're making sure that there's no redness, edema noted. We're noting the temperature of her skin. And now we're going to inspect and palpate the scalp and the cranium. While we're here, we're noting the hair and the color and the consistency and how it's distributed and the length. Okay, now what we're going to do is inspect the face for expression and symmetry. So I would like you to smile. Okay, as you're smiling, I'm noting that there's no facial drooping. The ears are in line with the eyes and everything is symmetrical bilaterally. Okay, now we're going to move on and palpate the temporal arteries. And we're noting them at a regular rate and rhythm. Okay, now we're going to palpate the temendular joints. So we're testing for TMJ. Will you open and close your mouth? And we're noting that to be within normal limits as well. Now we're going to test cranial nerve 5, which is the clenching of your teeth and the sensory function. So will you clench your teeth? Okay. And with the sensory function, I'm going to ask you to close your eyes and tell me if this object is sharp, soft, or dull.
Sharp.
Okay. Sharp, soft, or dull.
Soft.
Okay. So we're noting that to be within normal limits as well. We're going to test cranial nerve 7, which is the motor function. So I'm going to ask you to smile, frown, close your eyes really tightly. Okay, open your eyes, lift your eyebrows, and puff out your cheeks, and clench your teeth. Okay, thank you. So we've noted that to be normal within normal limits as well. Now we're going to move on to cranial nerve 2, which is the visual acuity test, which is the Snellen chart. So we've marked over here, 20 feet away, where you need to stand. And with both eyes uncovered, I would like you to read the line 20.
TEPOLFDZ.
Okay, now covering your right eye, read the same line.
TEPOLFDZ.
Now covering the left eye.
TEPOLFDZ.
Okay, so we're noting that the cranial nerve 2 visual acuity is a 20/20, which is perfect vision. Okay, now we're going to move on to cranial nerve 3, 4, and 6. And this is testing for equiocular movement, pupil size equal the rate that is reactant to light, and the accommodation and conversions. Okay, so I just want you to look straight at me, and I'm going to shine a light in your eye to look at your dilation of your pupil. Okay? Okay, so we're noting that those are both reactant to light bilaterally. Okay, now I just want you to focus on me, and when this pen moves, you're going to move your eyes with the pen. Okay? Okay, and then now focusing on the pen. Okay, good job. So we've noted that cranial nerve 3, 4, and 6 are all within normal limits as well. Now we're going to inspect and palpate the external eye. So we're looking at the eyebrows and making sure that they are evenly distributed, and they are. We're looking at the eyelashes, and we're noting that those are evenly distributed and equal in length and long as well. Now we're going to inspect the conjunctiva, the sclera, the irids, and the pupil. and the sclera is white where it's supposed to be white. We're noting that she has green eyes and that her pupils are about a 3 millimeter as well. Okay, now we're going to move on to the ears. And we're looking and making sure that the ears are intact, and they are, and there's no drainage. Noted. Is there any tenderness when I touch your ears?
No.
Okay. Now we're going to test cranial nerve 8, which is the whisper test. So I'm going to come over here. I'd like you to cover one ear and repeat the word I whisper to you. Red. Okay, now covering the opposite ear. Green. Okay, so we're noted that those are within normal limits as well. Now we're going to test cranial nerve 8, the Reiner and Weber test. So I'm going to hit this on my knee and you'll hear a sound. I want you to tell me if it is louder in 1 or 2. 1 or 2.
1.
Okay. Do it again. 1 or 2.
1.
Okay. And then I'm also going to do it in the middle, and I want you to tell me if it's louder in your left, right, or in the middle.
Middle.
Okay, perfect. So that is noted to be normal as well. Now we're going to move on to the nose. And we're going to inspect the nose, making sure that it is midline, it is intact. And we're going to test it for patency. So I want you to cover one nostril, breathe in and out. Okay, and then the opposite. Okay, so we've noted that the patency is normal as well. So now we're going to test the sense of smell. So I'd like you to close your eyes and tell me what this smells like.
Alcohol.
And this is indeed an alcohol swab. Now we're going to palpate the sinuses. So we're going to palpate the frontal. Is there any tenderness?
No.
And we're going to palpate the maxillary. Is there any tenderness?
No.
Okay. So now we can move on to the mouth and throat. Will you open your mouth for me? I'm looking at the buccal and mucosa, noting that there is no redness, drainage, or edema. It is moist. And we're noting that all teeth are intact. And we're grading the tonsils to be a +1. The uvula is intact as well. The tongue is evenly distributed. You lift up your tongue. And the soft and hard palate is intact as well. Now we're going to test cranial nerve 9 and 10. So you open your mouth again. And when you say ah, we've noted that that would be a positive. And will you stick your tongue out for me? Okay. And we've noted the evaluations cranial nerve 12 to be equal symmetrically as well. Now we're going to test cranial nerve 10, which is the gag reflex. Will you open your mouth? Okay. So we've noted a positive gag reflex as well. Okay. Now we're going to move on. And we're checking the neck lymph nodes. Okay. So we're first going to do the pilaria. Okay. Post-ocular. Okay. The occipital. Okay. The superficial clavicle. Okay. Submandibular. Okay. Submandibular. Okay. Toncular. Okay. Deep cervical chain. Okay. Posterior cervical. And the subclavicular. And we noted that the neck lymph nodes are within normal limits as well. Now we're going to check cranial nerve 11. So I'm going to ask you to put your chin to your chest. Okay. And then raise your head back up and lift it all the way back. Okay. And then I want you to touch your ear to your shoulder. Okay. Ear to opposite shoulder. Okay, now we're going to test for resistance, so I want you to push with your head, okay? And we've noted that to be within normal limits as well. Now we're going to palpate the trachea and the thyroid. And we've noted that to be within normal limits as well. Now we're going to inspect and palpate the carotid pulses, but one at a time. And we've noted those to be regular rate and rhythm. Now we're going to auscultate for any carotid bruits. And we've noted that to be normal as well. Now we're going to move on to the chest, posterior lateral position. So if you'll turn a little bit so we can see the posterior part of your chest. And we're going to move your hair over here. We're looking and examining the back part of her chest and inspecting and making sure that everything is within normal limits and her posture is good. Her back is in line and there's a little curvature. So we're looking, first I'm going to ask her to say 99, and we're checking for tactile thinness.
99.
99.
99.
And 99.
99.
And I'm going to ask you to take a deep breath in and exhale. In and exhale. In and exhale. And that's when we're checking and making sure that the symmetrical expansion is equal bilaterally. Now we're going to percuss all over all lung sounds. And let me know if there's any tenderness. Is there any tenderness noted? Okay. Now we're going to percuss for coast vertebral femur. Is there any noted there?
No.
Okay. Now we're going to auscultate all the lung sounds. Okay. Take a deep breath in. In. We've noticed that there's no adventitious lung sounds, no crackles, wheezings, or rhonchi noted. Now we're going to expect it. I'm going to ask you to turn back towards me, and we're going to inspect the upper extremities. So your arms are equal in length bilaterally. Okay, is there any tenderness?
No.
Okay. Now we're going to turn them over and rest them on your legs, and we're going to check for the pulses bilaterally. So we're looking at the brachial, okay, the radial, and the ulna. And those all are equal rate and rhythm and good strong pulses. Now we're going to assess the capillary refill. So turn over. And we've noted those are within normal limits as well. Those come back within 3 seconds. We're going to notice the skin turgor, and those fall within normal limits as well. Now we're going to test the range of motion of the shoulders. So I'm going to ask you to lift your arms above your head. Okay, back down. Okay, now behind you. Okay, and back beside you. Now we're going to ab and adduct your arms. Ab is away and add is towards you. Abduct them away and adduct them towards your body. And we notice those are within normal limits as well. Now we're going to test the range of motion of the elbows. So if you'll put your elbows up and extend and flex. Okay? And then now we're going to supinate and pronate. So up, out is supinate and pronate is down. And do that one more time. Supinate and pronate. And we're noting those are equal bilaterally as well. Now we're going to test for resistance. So I'd like you to push against my hands. Okay? Now I'm going to push against yours. Okay? And those are within normal limits as well. Now we're going to test the range of motions of the wrist. Okay? You stick your wrist out. Now I'm going to ask you to hyperextend your wrist back, extend up, and flex down. Okay? Now I'm going to ask you to put your fingers in a ball. Okay? And then I'm going to ask you to extend your fingers up and out. Okay? And then touch each finger to the thumb. And do it one more time. Okay, and we've noted that those are within normal limits as well. Now we're going to test the cell bone function. So I would like you to stick your arms out and touch your finger to your nose. Okay, and then finger to nose. Okay, those are within normal limits as well. Now I'm going to test for grastivia and sternosis. Grastivia first, so I'd like you to close your eyes and tell me what I'm drawing on your arm.
S.
Okay, opposite arm.
H.
Okay, and I'm going to hand you something and I want you to tell me what you think it is.
Cotton ball.
Okay, and that is a positive sternogus test. Now we're going to, you may open your eyes, and we're going to test the reflexes of the upper extremities. So, with doing that, we're going to test the triceps first. Okay, relax your arm. Okay. And then we're going to test the biceps. Okay, and now we're going to test the brachial. Okay. Triceps. Okay. Biceps. And brachial. Okay. And those are all noted to be normal as well. Now I'm going to ask you to lay down and we're going to examine the chest interiorly. Okay? What we're doing here is we're going to inspect the chest and make sure that everything is in line, and it is noted. And we're looking at her rate of her respirations. Okay, and we're noting that there is unlabored breathing. And now we're going to inspect and palpate the precordium for any PMIs, pulsations, heaves, or thrills. Okay, now we're going to listen for any adventitious lung sounds in all quadrants of the lungs. And we did not notice any adventitious lung sounds as well. And now we did that with the diaphragm, so now we're going to do it with the bell. And now we're going to listen to the heart. And I'll name them as I go. Aortic, pulmonic, mitral, and tricuspis. And that was with the diaphragm, so now we're going to listen with bell, aortic, pulmonic, mitral, and tricuspis. And we did not hear any extra heart sounds, and the S1 and S2 are noted as well. Now we're going to move on to the abdomen. So I'm going to lift up your shirt, and still remaining providing privacy. We're inspecting first and looking at the contour shape of the stomach, and we're inspecting and making sure that there's no abnormalities, and there is not. We are noted that there is a couple of freckles noting, but that is nothing to be alarmed about. Now we're going to auscultate all 4 quadrants of the abdomen. And we're noting that all 4 quadrants have active movement, which is good. Now we're going to auscultate for aorta or bilateral renal arteries and bilateral renal arteries. So aorta first and bilateral renal arteries. And while we inspected the stomach, we noted that there was no visual paralysis or pulsations. Now we're going to percuss all 4 quadrants. Okay. Now we're going to lightly palpate. Is there any tenderness anywhere? Any tenderness? Okay. Now we're going to deep palpate. Okay, and now we're going to palpate for the liver. Okay, and now we're going to move on to the lower extremities. We're going to inspect and palpate the lower extremities after we search for privacy. Okay, we're going to inspect and make sure that everything is symmetrical, and it is. They're in line. Okay, I'm going to take off your shoes. That's okay. And we're going to check the pulses of the lower extremities. So the popliteal pulse is behind the knee. Okay, and now we're going to inspect the feet and the pulses of the feet. And this is the posterior tibial, and this is the dorsal pietus on top of the feet. Now we've palpated for any pre-tibial edema, and there is none noted. Now we're going to test the range of motions of the hip, legs, and knees. So up at a 90-degree angle, knee to chest. Okay, I want you to bend your knee inwards and outwards. And now we're going to do that again. Leg all the way up. Okay, knee to chest. Okay, inward and outward. Now we're going to abduct and adduct your leg. So I'm going to abduct your leg out and adduct your leg in. Abduct your leg out, adduct your leg in. So we've noted those to be all normal, within normal limits as well. Now we're going to test the range of motions of the feet and ankles. So I'm going to ask you to dorsal flex your feet up, plantar your feet down, invert them in, and evert them out. Okay, now we're going to test for resistance. So I'm going to ask you to push against my feet, my hands. Okay, and we noted that to be normal as well. Now we're going to test the reflexes. So I'm going to do the Babinski, and noting that her feet flare up is a positive reflex. Now I'm going to ask you to sit on the side of the bed again. Okay, and we're going to do the patella reflex first. Okay, those are noted to be normal. And now we're going to do the Achilles. and we noted those to be normal as well. Now we're going to do the cerebellum function. So I ask you to put your right foot down the left part of your shin. Okay, and then now the opposite. Okay, we've noted those to be within normal limits as well. Now, last, we're going to test the lower extremities in the standing position. Okay, now I'm going to ask you to walk to the piece of tape on your heels. Okay, now walk back here on your tiptoes. Okay, we've noticed that while she was walking, we were observing her balance and her gait, and we've noticed that there's no unsteadiness. Now we're going to perform the Romberg test. So I'm going to ask you to put your arms out in a T shape, and I want you to touch your index finger to your nose. Okay, and opposite. Okay, and we're looking at her balance as well there. Now we're going to assess her muscle strength and cerebellar function. So I'm going to ask you to hop on one leg. Okay, and then now the opposite. Okay, and now we're going to inspect and palpate the spine. So I'm going to ask you to turn. And as you're bending down, touch your toes. Okay, come back up. And I was noticing her curvature in her spine. Her posture is good as well. Now I'm going to ask you to bend backwards. Okay, and then bend side to side. Okay, now I'm going to ask you to twist your shoulders. And we notice that all the range of motions are within normal limits as well. This concludes our physical assessment from head to toe. I thank you so much for participating.
Thank you.